Good afternoon, everyone, and thank you for joining us today. I'm Jenny Montgomery. We're talking today about a drug you've heard about in the news, a party drug known as Special K, often stolen from veterinary clinics, ketamine. You've also heard of it as a date rape drug, but you need to know about the legitimate uses of ketamine. It's used medically with anesthesia and as a treatment for depression and pain management. In March of 2019, the FDA approved a nasal spray antidepressant sold as Spravato. It contains a substance similar to ketamine. The medication is intended for patients who have tried at least 2 other antidepressants without success. And earlier this summer, a ketamine infusion clinic opened in Evans, Georgia. It was established to provide cutting-edge ketamine infusions, offering hope and recovery for patients battling mental health ailments. As the only clinic of its kind in the area, the team is uniquely trained to administer ketamine infusions for the treatment of mood disorders. And the leader of that team is with me today. Her name is Lauren Bursey. She's a family nurse practitioner. Lauren, it's great to have you here.
Thank you for having me.
I'm so excited to learn more about this. Your mission in doing this clinic, and it was a big goal in your life to open this, but you want to help people who are suffering from mental illnesses recover, and this is another way to do it.
Yes, ma'am. So ketamine's indicated for patients who have treatment-resistant disease. So if you have depression, PTSD, anxiety, and you've taken multiple medications like a Zoloft or a Lexapro, and you haven't achieved recovery, ketamine can kind of help pull you out of that hole and help you get back on the track of life.
Now, one thing that I didn't quite, it doesn't quite make sense to me, it's called a dissociative drug, ketamine?
Yes, ma'am. So you can have a dissociative quality. So some patients feel when they get ketamine that they have an out-of-body experience. In our clinic, we've seen a lot of patients who are very well aware we're there. They talk to us, they look at us, but they close their eyes and maybe they're somewhere else. I had a patient who felt like he was surfing with one of his best friends. So it's very patient specific. It's mostly dose specific. So we use 0.5 milligrams per kilogram, which is much less than you would use in the OR or the ICU or the ER.
Because it's used in the OR to help maintain anesthesia.
Yes, ma'am.
Right.
Yes, ma'am. So in our clinic, it's not. It's a 40-minute infusion. It's given IV. There are other ways that you can get ketamine, but right now in our clinic, we're only doing IV.
Right.
And patients, about the 20 minutes in, they start to feel very relaxed and they're able to experience that dissociative effect if they want to. If they don't like it, they just keep their eyes open and talk with me or their family member or even their therapist.
Really?
Yes, ma'am.
So the therapist can come with them, or you have a therapist there? Is that
Their
what you're
therapist
saying?
can come with them.
Your therapist
yes,
can
ma'am.
come.
And so we
Okay.
have 2 infusion rooms. They're big enough for another person to sit in the room other than myself, because I am with the patient the whole infusion, taking their vital signs every 5 minutes. But they can have their family member or their therapist come in, and they can do talk therapy during the ketamine infusion. So we work closely with a lot of therapists in our area, especially in Evans and Martinez, who will come with their patients to do that.
Well, you know, you hear about other kinds of treatments that are used for people who are resistant. I think there's like a magnetic kind of therapy, and the electric shock, that's not what they call it, ETC.
Oh, there is a lot of different things.
Yes. Yeah, a lot of different things.
There are.
And so this is way less invasive
Correct.
than anything like that. We're not having to put electrodes on anybody. You're just giving them an infusion.
Correct. So in our clinic, we have a blood pressure machine that takes your blood pressure actually on your finger, so there's no cuff like in the hospital. We have chairs that lay all the way down. The room is cold. We can dim it, dim the lights. We have a room that has a window if you prefer. Some of our vets with PTSD want to be able to look out the window. It makes them feel safer.
Right.
We have oxygen in there if something were to happen. So we have the medical aspect of it. It's clinically sound, but it also has the spa feel. So it's 1 patient per appointment. It's a 2-hour appointment, although the infusion itself, start to finish, is done in recovery within 90 minutes. And that way you just are relaxed. You don't have to worry about anybody else but yourself during this infusion.
Is it almost like just sort of coming in and taking a nap? in a way?
Kind of like lucid dreaming. So before we opened the clinic, my doctor sent me for an infusion after we had some infertility problems. And so I went to a clinic and had one. It was a very good experience. The music, patients like to listen to music, and that kind of guides what you see. But it just kind of felt like I was dreaming. And if I felt the dream was too intense or I didn't like it, I could change that in my mind, or I could open my eyes and look at the provider. Yeah,
Really?
You should come get an infusion.
Okay, so someone is sort of guiding you through that.
Yes, ma'am. I am right there with the patients the whole time. And so if patients get nervous, we are able to talk with them about it, and we encourage that.
I mean, Lauren, I get nervous sometimes when the dentist has to give me something.
Yes. Well, I get nervous even going to the dentist. Yes. Yes.
When I'm given, sometimes whatever they use to numb me, I
Yes.
don't like that feeling in the rapid heartbeat,
Right.
and so the dentist will have to stay with me. But that's what you're saying, because drugs affect people differently,
They
and so
do.
you're there to help people.
Correct. Yes,
And
ma'am.
and like you said, if they're getting nervous about something, you can redirect.
Correct. And we love for patients
Wow.
to think about things that do make them nervous, whether they're good memories or things that they're impending, if they want to open a business or if they have an upcoming wedding, different kind of things that people get nervous about, and talk through it.
Yeah, because anxiety doesn't have to be depression.
Correct.
You certainly can address depression
Yes.
issues. But you're also talking about anxiety and other things this can help with.
Yes, ma'am.
How many treatments would be effective?
So clinical data shows that 6 treatments over 28 days. Most patients will come in for an infusion on a Tuesday, a Thursday, and we do that the whole way through if that works for them. Some patients feel better after 4 infusions, so they may wait and just get another infusion at a later time. It's really patient specific. Our vets that we've treated, they get 6 over the 28 days. They've done very well. We have several patients who have come to us straight from alcohol detox, and so we do more intensive therapy and close monitoring with them over those 28 days. I have some patients who have had trauma, they've had child loss, and so they do maybe 4 or 5 infusions, and then at the date of birth of that child or the date of the loss of that child, they'll come in for an infusion, or at Christmas. There's a lot of ways that you can use ketamine to kind of help with those intense bouts of depression, PTSD, anxiety, depending on what it is and where you're at in your journey.
When you studied here in Augusta.
Yes, ma'am,
and
at
then-
MCG.
Yeah, at MCG, and you also practiced at Fort Eisenhower.
Yes, ma'am. So I was out there for 4 years in soldier care, and that's kind of how I got here. I had a lot of soldiers who were my age in their late 30s coming back from deployments, and they are broken, I
Yeah.
would say. Your brain, obviously you're deployed, you go into a survival mode, and that's where ketamine really helps. When you have a traumatic event, your brain rewires itself, and ketamine increases the brain's neuroplasticity, and so it allows the brain to rebuild the connections that it lost during that traumatic event. And so at Fort Eisenhower, we have lots of soldiers who are constantly being deployed. They come back, and our ability to offer them treatment to live the rest of their lives is very limited, unfortunately. They're giving ketamine to vets in other areas of the U.S. They're using it a lot in New York and California and having really good results. So we're hopeful to get on with the VA to bring in those vets.
That is so exciting.
We are very excited.
That is so exciting, and I love the cutting edgeness of all of this.
Yes.
It's really fascinating. Lauren Bursey, I appreciate your time today. And if you are interested in ketamine infusions and learning more about what Lauren has talked about today, here's the contact info. You can learn a lot more about ketamine infusions by visiting Elevated Health Augusta. It's at 7013 Evans Town Center Boulevard, Suite 203. That's in Evans. You can call 706-426-7383 or visit their website at elevatedhealthaugusta.com.